59 minutes. That's how long heart attack and stroke victims have waited on average for an ambulance in 2022. 4 hours. This has been the target wait time in accident and emergency since 2004. In 2021, over 1,000 patients waited more than 12 hours every day, leading to a 16% higher chance of death. 2.5 million people were waiting in hospital for treatment in 2010. Today, that number is 6.4 million, almost half waiting over 18 weeks. Why? What happened to the NHS? Today, I will tell you. So stick around to the end of this video, as the depth of this corruption might shock you. The waiting time target, which states that 92% of those on the waiting list should have been waiting for under 18 weeks, hasn't been met since early 2016. This list includes people with serious diseases such as cancer. Since 2012, the 4-hour target was met only 18 months out of 107. This shouldn't be happening, but it is. Why? Now, to figure that out, we need to figure out when. Take a look at this graph. Do you notice a trend over the past 12 years? How about this? Notice where it falls off a cliff? Can you think of anything else that happened in 2012 and continued for 10 years? Yes, the Tories. Always the Tories. Over 12 years, investment in healthcare as a share of GDP has fallen each year. And this is compounded by the fact that GDP itself has dropped under the Tories. This means that population growth has not been taken into account into the budgeting of the NHS. But it gets worse. The pound amount for social care funding is actually lower than 10 years ago, while the people who need it is up 60%. The UK is an aging country and has been forced to do more with less when it comes to something as essential as healthcare. Next is privatisation by stealth. Without making headlines, as mainstream media doesn't work for you, the Tories sold off parts of the NHS over the past 12 years. Privatisation is a Tory goal, make no mistake. Here's Grace Barclay talking about it.
The amount that we're spending relative to our health outcomes, it's no way near a different kind of system, say like the US, right, which has a completely privatised system and which spends extortionate amounts of money paying for healthcare. The NHS is affordable.
Individuals, do you mean?
No, the government and Medicare and Medicaid, and also on top of the amounts that individuals are paying as well. So the system is sustainable. In fact, it could be more sustainable because you have all of these services allegedly supposed to be under one roof. But it's quite right to hear Dr. Amir saying that this could be privatisation by stealth, because this has been a long-standing tactic of Conservatives to basically underfund the NHS, rely on the fact that their mates and people who vote for them will then be able to go and get private treatment and allow the NHS to become something that, poorer people use as a last resort. It's not acceptable.
Private firms cherry-pick easy, high-cash patients, leaving the NHS with even less resources to deliver its service and to survive. Now you know why things are so much worse now than 12 years ago. I'll show you in one graph why they don't care. Life expectancy in the UK fell over a year since 2015, while the rest of the world saw life expectancy go up. This is due to those in the deprived areas, of course. They don't work for you. Boris Johnson promised 40 new hospitals. 0 have been built. 0 have been built. Now for something truly shocking. Not that I think the Tories could shock us anymore. Jeremy Hunt, Health Secretary, from 2012 to 2018, an author of 2005 book Open Democracy, calling for the abolition of the NHS. He oversaw 3 times more patients waiting over 4 hours in A&E, an 8,000 bed decrease in the NHS, and a rise in bed occupancy rates to 90 to 100%. Cancer referral and waiting time targets missed every single month under his watch. Restricted hernia, hip and knee operations until patients were in severe pain. Removal of the right to consult locals about hospital closures. This is a big one. This led to many hospital closures, record privatization schemes, and privatization failures, including the rewarding of failed contractors with more contracts after avoidable patient deaths, and banning independent watchdog reviews of failed projects. The first junior doctor strike in 40 years, and record 12% vacancy of nurses. Maternal and childbirth deaths and infant mortality rates reverse trend and worsen after decades of improvement, admitting to data tampering, data hiding, and decreasing reporting standards. An average 1% funding increase per year compared to previous 6% increases, and the 4.3% recommended by the Office of Budget Responsibility. An amazing CV. I'm surprised this man is still in politics. The shocking part is the man is related to a Tory baroness, Virginia Bottomley, who is in the business of private healthcare. The person who is in charge of socialised healthcare has personal and financial motives. What's the matter? You really can't make this up. Your suffering really is profit to them. I know this has been a bleak video, but there is hope. The NHS have released an elective recovery plan that I'll link in the description. There is a massive backlog and the NHS have realised this, and I would say they are working tirelessly to fix it. But they're doing so with the Tories working against them. The Tories' neoliberal approach to medicine means the NHS can't deal with health emergencies without buckling. As the population ages and grows, these will become the new emergencies that we can either be prepared for or not. And that's all for today. If this video was useful, drop a like and leave a comment if you'd like to see more videos in the future. Share it to spread the message, and how if left unchecked, it will only get worse. Check out my previous video on corruption in the UK. Okay, talk soon.